Just
Thank you for that elaborate introduction. So now I guess I am the odd one here, listening to the distinguished speakers. I'm not a technology person. I'm zero in innovations and zero in AI. So now coming to that ground reality, I am an odd one here. Now, just being a clinician, I am here just because of one reason that we all have. Can anybody tell? Just because of one reason I am here. I'm a clinician, and you might have listened to the introduction part. But again, keeping aside all those credentials which I have, one reason is common for all of us, and perhaps it should be common for all of us. Coming to this topic, it's just a kind of empathy. It's just empathy that is why I'm here. So I hope throughout the presentation, I just request all of you to just keep watching your feet. Just keep watching your feet and your shoes. Throughout the presentation, I would request everyone to just look down. Okay? So I hope I'll be able to convince or maybe convey the whole idea to all of you. So let me begin the topic. As the slide says this is my topic. So it's all about women's health, mental well-being and substance use challenges. So this gives you an idea that what is my credentialing to this area. But again, I'm telling you, based on these credentials, I'm not a person to involve too much into this area. Truly speaking, I'm not an expert in this area. I'm a beginner in this area. But still, based on the empathy which I have been or maybe I'm having in this particular area, I'm here. So just we'll begin this topic. Let me just ask you one simple question. What is the meaning of fundamental? What is the meaning of fundamental? Perhaps we'll go to the women's health aspect, or for a woman, what can be the meaning of fundamental? To be more precise to that question, can anybody just give me any thread related to the word fundamental? Basics. Elementary. So coming to woman, what can be the fundamental that she is expecting from us? Support. So from that word fundamental, I think we'll begin the session. So this is the stage wherein I'm about to start my talk with a triple burden. So as the title itself says it's going to be a triple burden. When it comes to the women population, always we need to focus upon the physical health, we need to focus upon the mental health, and perhaps we need to focus upon the substance use challenges. Being a person from Kerala, do you know what Kerala is suffering now? I mean, what is the gripping issue which we need to encounter now? Being a person from Kerala, you should know, especially when it is coming to the handsome boys like you and beautiful girls like this. You should understand what is happening in Kerala in terms of substance use. So that is why I intentionally selected this topic. Why? Because we should understand. We should understand what is happening to the young youth and the adolescents and even the 5 to 6 year old kids. What is happening? Okay. So with that word meaning fundamental, I would request you to just scan this QR code. It's going to be fun. Please. Don't worry, this is not going to be a quiz or something. It's going to be a fun. So I would request everyone to please scan this QR code. There is nothing like right or wrong in this. I hope Is that done? Towards the back? Okay. Okay. So, now just come and see this picture. Okay, just go through this picture and there we'll start our... So normally once you scan that, you will be able to access this question and you will be able to answer it. So you have gone through that picture and my question is, which among these is your option when you hear the word perfect lady? So already option 1, option 2, option 3 is coming. So I think some of you are able to do it. Can you just raise hand? I mean, whoever can go with these options, please raise your hands. Please raise it. Okay, so it's functioning, right? So option 1 is 2, option 2 is 9, option 3 is 5. Yes, sure. So I don't know, option 1 can be from the red. Option 1, option 2 can be the middle one and option 3 is the right one. I mean, the towards my right, it's green. Okay, the question is clear. According to you, which among these is a perfect lady? Do you find some difference? I've already mentioned there is nothing right or wrong. It's all about perception from our side. So my question is, what is going to be, who is going to be a perfect lady? Is there any answer from your side? Now, being a lady, I am asking. Being a lady, I am asking. According to you, who is a perfect lady? Now, from a somatic kind of, this physique, will you be able to comment something like a perfect lady just by a figure? So, is that question absurd? Do you agree with that? Okay. Then why those options came up? Option A, option B, option C. Perceptions, right? So that is why I already mentioned it is not about good or wrong. Okay. So coming to the next question. Do you think body image standards subconsciously create stress in young minds? Yes, you can select your option. Yes, so 16 going for of course, yes. We should stop such benchmarks. Yes, right, true. I never realized, but it does. Not really. Actually, one person is thinking there is no stress which is going to be there from physical appearance. We should stop such benchmarks. We should stop such benchmarks. So I hope you understood. Okay, so just by seeing the physique, if there is a particular benchmark like a lean person is a perfect lady, a lean lady is a perfect lady. We can even imagine the films or maybe the celebrities. Okay, always that lady should be a lean lady. That celebrity who is coming in front of you, we always portray that lady to be a lean lady, which is going to be like a perception in the sense a perfect lady. Right? So that itself has created a benchmark in our mind that a lean lady is going to be a perfect lady. Right? So ultimately, what we need to do is we should stop those benchmarks. Especially as a lady, I am talking to you, like We should stop those bench baths, then only we will be able to understand what we'll have to do for a woman. Okay, the first thing is we'll have to break that ice of those benchmarks. Then only we'll be able to move forward. So coming to the next question. This is for you. This is not just for a woman, this is for you. Rate your screen time, mobile or social media time, and its impact on your mental well-being. I'm addicted. 5 are addicted.
Number.
So I just want to meet those 9, okay? So please wait, so that I can just take some tips from you. It's going to be help me in my career again. So I just want to meet that I am in control, 0 to 2 hours daily. No, please wait, please. No, don't take it seriously. I just want to get some tips from you. Okay, please wait. And manageable, okay, 32. 6 are addicted. Again, those people, if you are waiting, again, it's good for me as a clinician. Okay, right? Okay, so shall we move to the next question? What is more difficult for today's adolescents? I mean, in this particular stage, I can change that question. What is difficult for today's youth? I'm not just restricting my question to adolescents. For you people, I am just going to change that question as for today's adolescents, what is going to be more difficult? Academic stress. Sir, you should take care of that. Okay, then. For 39, okay. Definitely we should take a screenshot, right? We should take a screenshot and we'll have to do something for that, right? Now, as a person from the mental health perspective, I'm telling you, we should take this screenshot and we'll have to take steps, right, sir? We'll have to do something for that, right? So, shall we move to the next question? Perhaps the last question. One fundamental habit you believe can prevent 90% of the lifestyle disorders. No. It's not a multiple choice question. Have you ever been to Mentimeter? Okay, you can type. Workout, food, sleep, meditation. M. Oh, M is the short form for meditation. Okay, meditation is very long. Yoga. Get a girlfriend. Vodka. No, I don't know whether I would be able to trace from which all accounts it came up. AI can help, maybe sir can help me to find out what is happening here. I don't know, maybe because of the ethical constraints I won't go to that aspect. Okay. So after reaching home, I'll be going through these results and will be able to communicate with sir regarding the results. Okay. So shall we stop here? Or so definitely we should prepare a list with these things and we'll have to conduct a survey. Okay. So we'll go back to our topic. Okay. So with this basic understanding what you are getting from this kind of quiz, let me just take your attention to this particular picture, in which actually the lady is in stress, right? So maybe I would like to draw your attention maybe from boys. You are actually 20 years old now, maybe. Majority are maybe 20 years old. So just imagine your mother being in an age of 45 or 50, right? 45. So at this particular moment we'll consider it as 45. So what is the speciality of a 45-year-old woman? Can anybody from boys can just try to explain? I mean, what do you feel when you are talking with your mom of a 45-year-old lady? So can you just think about what is her the kind of attitude, or what is her physical kind of symptoms, what she is suffering from? Maybe from girls? Menopause, okay. So that is a milestone which she is about to attain. My question is, did you notice any kind of such mental illness or some kind of things what is different from her previous attitude? It's actually noticeable, but the thing is, when she is suffering and when she is about to tell her problems or her kind of stress what she is suffering from, definitely to her spouse or maybe to her son or daughter, what you will tell is, what can be the general kind of response from your side? Being a daughter, I am telling you. My mom used to tell me, she is a case of a surgical menopause. So maybe she had to undergone her hysterectomy on her maybe 35 year age. So then at that particular time, maybe after 2 years, her oophorectomy was done. And you can imagine her hormone levels. Okay. So you can imagine a normal natural menopause lady maybe in a 45-50 years and a surgical menopause lady maybe in a 35 year. So there itself there is a drastic change in the behavior of that mother. So when she is complaining or when she is telling her problems to her family members, what is going to happen is the boy or the girl will be in the adolescent age. Right? So try to imagine that situation. When a 45-year-old woman is trying to not complain, I'm just trying to convince in the manner like when she is trying to express her feelings to her family members, especially to her children, the boy or the girl can be in the adolescent age group, and what can happen is, for you there are mood swings which is pertaining to your adolescent group or your early youth stage. So what is going to happen? Ultimately, the sufferer is going to be the woman. No, you won't give up, right? Even the mother will think, oh, she is my child. She is my son. Isn't it? So you cannot expect that woman to complain or woman to go to a psychiatric center or a mental illness center and just telling her concerns. You cannot expect that. So this is how we are placed in a setup of a reactive healthcare setup now. Especially when it comes to the mental health care, we are in a reactive setup. Why? Because if a woman is complaining something, if she is into a gynecologist or an obstetrician, and they'll have to refer that lady to a psychiatrist, and therein that particular loop should work. Then she'll be able to, she'll get a consultation from a psychiatrist or a psychologist, and a counseling can be done. But you cannot expect that kind of situation for every woman. Why? Because the loop will not work. So when she is expressing her concerns to her spouse or maybe to her children, there itself that loop is broken. And from there, you cannot expect that lady to visit a psychiatrist or a mental health care clinic. You can expect that adolescent to, perhaps maybe in this particular situation, I can just tell, the adolescent can go up with maybe can go to a psychologist and Even I do have so many students and patients which they'll be coming to my clinic and they'll be telling, Madam, I have depression. This is the wording from students. Maybe 17-year or 15-year kid will come and tell, I have depression. No, I'll be like surprised and I'll be just asking her, why you are telling you have depression? So she is actually trying to express her feelings in the terms like she have depression. She don't know what is depression even. She don't know what is the mental illness even. She is trying to express her emotion, maybe a sad emotion or a pressurized situation like academic stress. She is trying to portray it in terms of an anxiety or a depression, which are actually mental illness. So my point is, for a woman actually everything is stress. Taking care of her child, taking care of her husband, everything is going to be stress. So how can a person maybe from her family or the society can judge her? Is it going to be possible to judge her? Like we'll be telling, as sir was telling, kude. Like they are expecting us to be with them. Not like you can just go on. It's normal. It's normal for a menopausal lady. It's not like that. They are not expecting those words. They are expecting, like you can tell, Mom, it's there. I can understand your feeling. But we'll take a consultation from a gynecologist or from a psychologist and we'll try to understand what is happening to you. So there, that particular ice is broken and she'll be able to meet a psychologist or a counseling center or maybe a mental illness expert, mental health expert. Okay, so that is why we will not be able to recognize what she is facing or we will not be able to judge what is her emotion. Especially when it comes to a woman, we will not be able to judge it. So that is why I am not telling this, that woman is telling you. You can just go through. So please keep watching your feet, okay? So please keep watching your feet and your shoes, and that woman is telling you what you should do. You are not supposed to judge me based on my emotions, based on my symptoms. Who are you to judge me? Even medical doctors are not able to judge me. Even my family members are not able to judge me. And so don't judge me. So you please try to understand what is happening within me. So that is called as empathy. Okay. So try to watch your feet and your shoes and at least try to understand what a woman is suffering from her major milestones. At least from adolescent you can just pick up. So adolescence is going to be a major milestone for a woman. So starting from adolescent, you just try to understand what is happening to a woman. And then be with that woman. Be it your mother, be it your, for boys, be it your sister, be it your wife. So all these, be it your grandmothers, so everybody. So considering a woman, be it your daughter, oh yes, right. So before judging anyone, especially women, they don't want your judgment. They don't want your diagnosis. They just want your support. Okay. So once you wear that shoes, you will be able to understand what is her suffering. This is her suffering. Okay. So I started this work maybe 3 or 4 years back. So now I understood this is her situation. So from now, at least you check your feet and your shoes and try to understand what a woman is suffering from, and you will be, at last you will be ending in this particular, you will start your journey from this dark tunnel. So this is what she experienced. Okay. So being an Ayurveda person, being with these credentials, what we can do at this particular stage. So from the Ayurveda, everybody is well aware about the different terms like yoga, pranayama. I hope everybody is well aware about all these terms. So coming to that particular aspect, I would request you to now just don't get just concentrating upon yoga and pranayama wouldn't entertain or maybe wouldn't modify the crisis what a woman is suffering. Definitely yoga and pranayama can help, but that itself is again a reactive approach. If a person is coming to your OPD, you can definitely engage them with yoga and pranayama, and so that it will help. But coming to a proactive approach, that's why I'm here. So coming to a proactive approach, how can we recognize or how can we diagnose that this particular woman needs some care and attention? So to be more precise, at least the major milestones like perimenopausal, menopausal, premenstrual, or the adolescent age group, pubertal age group, pregnancy period, postpartum period. So all these are the major milestones in which a woman is suffering from such a kind of hormonal milieu will be there. It's not their physical symptoms which they are expressing. It's based on her physical symptoms from the hormones, their mental health is going to be devastated. So that there can be multitude of symptoms. So we need to take care of that. At least go through these milestones and try to understand what is happening. And my request to you people as maybe technology experts, as maybe from the BTech kind of streams, personally as a compassion driven research kind of thing, or maybe as an empathy driven, you can just think about your mother, your sister, your wife and your family. But definitely as a person, as a responsible citizen of the country, we should definitely go with a kind of a sustainable model which is going to help these women who are suffering from mental ill health. Okay, so normally my sir who taught me regarding the principles of psychology used to tell me, don't call any particular disease as mental illness. There is nothing like that. So he always tried to teach us that don't call it as a mental illness, just try to call it as an emotional turbulence. So always I used to tell to this word to my students. Why? Because they shouldn't just diagnose a case. As sir was telling about special needs children. So my sir used to tell me, for an autistic child, he always taught us, don't ever diagnose a case as an autism. Now, just try to, maybe once the diagnosis is done as autistic spectrum disorder, you can imagine what kind of mentality or what kind of attitude that you can just imagine upon from the parents. So once the diagnosis is ASD, it is autistic spectrum disorder. So he always taught us that it's not a kind of autistic disorder, or we are trying to diagnose it as autistic. It's not that important. The important thing is, if an autistic children or if an autistic child is coming to your OPD and the parents will be there with that particular child, means important that that particular child can fly. So you should teach the parents, or you should tell the parents that you don't compel the child to walk. Those special needs children are for flying. So you cannot expect the child to walk, or you cannot expect the child to maybe run, but those children are actually capable of flying, or maybe the sir was rightly pointing out all those things. So that is why my sir used to tell, don't just diagnose these cases as just mental illness like depression, depressive disorder. Those are actually celebrity terms that we can use, but it may not be the reality. When it comes to the ground reality, those may not be the right diagnosis. Okay. So coming to Ayurveda, we do have many, Mano Vikara, there is a spectrum of mental illness. I shouldn't use the word mental illness, but for you, maybe as persons which are, from different area, I should address it as mental illness. So coming to the mental illness, we do have different concepts related to the Mano Vikaras, and we do have so many therapeutic strategies for a reactive kind of health sector. But coming to a proactive sector, we want the collaboration from the technologist, so as AI can help us to understand the disease in a very young age. So for example, the postpartum lady with a depression. Postpartum, I hope everybody understood, it is after pregnancy. So once the lady is delivered, that particular woman is called as postpartum woman. So once a postpartum woman is complaining with a depression, so normally there is an associated stigma, especially in Kerala and in the rural parts of the country, wherein if she is suffering from some kind of emotional disturbance during the postpartum, they will not open up. So if she is trying to open up that particular feeling to her spouse or maybe to her family members, what can be the response from them? Can anybody just tell what can be the response? What can be the first hand response from the spouse? Or what can be the first hand response from the mother? Not from in-law, from her mother. The first hand response would be, it's normal. Even I have gone through it. This is the first hand response. What I am expecting, and from my patients what I got is, if she is complaining something related to her mental stigma to any of the family members, the first response would be, it's normal, you're overreacting. It's normal, I have gone through this. Isn't it? So this is the first hand response. So we should change that attitude. So this is a general stigma what we are going through, and AI can probably help us to identify the cases of postpartum depression at an early stage. So if a particular adolescent lady is coming and adolescent child is complaining some symptoms related to it, now there are technologies in which we can use the AI to detect the postpartum depression or any kind of depression at the early stage, and we can intervene. At that particular stage, Ayurveda will help you. Now, being a proactive science, being a holistic science, we can make use of AI. We can make use of yoga and pranayama in schools. Already we have started that mission, but now the ground reality is International Yoga Day is there. Right? So that particular day and that particular month, everybody will be celebrating. But it's not going beyond that. Everybody at home, maybe for that month or maybe for 2 months, they'll be celebrating the yoga day, and it's not been into practice. So once it has been into practice, once we have identified a creamy layer wherein there is a high chance of getting this depression maybe in 3 or 4 years or maybe in the reproductive age, it's very good. So that we can make use of AI or the technologies what you people are learning, we can make use and predict something which is going to happen to them. Am I right, sir? Yes. So again, so one lady, if she is diagnosed with depression, again you can make use of these AI kind of tools wherein you can start the early intervention to avoid the neurodegenerative diseases. So everybody is well aware about the menopausal stage. So once the menopause or once the perimenopause, you will be expecting some kind of depressive symptoms in that lady. You won't even think about the cognitive decline. We won't even think about Alzheimer's. We won't even think about Parkinsonism. So this is going to happen in 2 or 3 days. So AI can definitely help. In a depression case, maybe after seeing a big data, AI can just predict a model wherein they'll be able to understand if a depression case is diagnosed at this particular age, start your treatment as early as possible so that we'll be at least control the pace of that reaching into a neurodegenerative disease. So in all these areas, we can take the help of the technologies, especially from you people. I would request you to come up with all these kind of technologies to help us, maybe as clinicians, to get through all these kind of mental illness. So as I was telling, all are deeply interconnected. So regarding the physique, what I am telling, it's true that if a lady is actually obese, it's true that she should treat. It's true that. Why? Because that obesity can be a lifestyle disorder, and it is a life-threatening disorder to diabetes, and it is a silent killer. Right? But now the women, by setting that benchmark, what we are thinking is, we won't go to a professional obesity, a nutritionist, or we won't go to a mental clinic so as to deal with that kind of stress what she is suffering. The thing is, we'll be going to, one possibility is because of that pressure, we can end up with a substance use. One possibility. We can. There is a high chance. But in Kerala, I don't know how much, what is the population which are going to a substance use because of this. But being adolescent, we can go. Right? Being adolescent, being with the physical issue, the ultimately because of that pressure, what we are getting from the academic side or from the PR group, we can end up with a substance use. So those things we can avoid. Definitely we will be able to avoid by incorporating all these tools in our system, especially to the healthcare system. So this is all about what I was telling regarding the blueprint for a sustainable health from Ayurveda. So basically we need a proactive approach, not a reactive approach. So we don't want that woman to come up to your psychiatry clinic or the mental health clinic or my Ayurveda hospital setup. I just want to be proactively approach each and every woman in the country so that they will be able to understand what is happening in their body. They should feel that empathy from the medical professionals and from all of you. So this is the missing link, what everybody is actually thinking about. You might have heard about this axis, gut-brain axis. It's actually a very hot topic for discussion now. So there is a particular axis which is directly connected from the gut.
3 minutes.
Yes. There is an established axis from gut to the brain, so that the brain chemicals will be released from the gut. So you can imagine what Ayurveda can do. Right? So now we have n number of probiotics in markets, no? Which is from celebrities. So what is the role of these probiotics to mental health or brain health? Just imagine. So this is what we can do in terms of substance use. So these are our my real world experiences with regard to the community driven models. So we used to conduct camps, especially to schools, and we realized the importance of empathy building workshops to doctors maybe. So that was most important what we identified. So we are doing empathy building workshops towards sensitization at the level of medical professionals and ASHA workers, who are the frontline community workers. We used to sensitize them, and definitely we need parenting and family counseling workshops. So these are some of our activities regarding all these. So now I would request you to collaborate with us for a fundamental process in India in terms of the mental health, and this is our vision. So it's going to be an integrative healthcare model, blending Ayurveda especially with the community action, and we will not be able to reach to the whole community just by our efforts. So that is why we need technology, we need AI to help us to get it through, or maybe get through all these activities towards the public. So it's definitely going to be aligned with the SDG. And so these are the project works or maybe the proposals from our side. We do have collaborations we are trying to get CSR partnerships for substance use prevention programs, and we do have collaborations with the medical geology department and NSIS for, all of you are well aware about the threats, or maybe what are we going to face in terms of the herbal products. So there is a huge scarcity that you can experience. So that is why we do have collaborations with all these institutes, and we expect you to collaborate with us to develop some kind of devices or maybe predictive models so as to incorporate those devices to the society. So to conclude, we need a paradigm shift. So actually now it is a reactive healthcare sector. So we need a proactive sector by utilizing all these technologies. Then only it is going to be a community engagement to the grassroots. So by integrating technology, by integrating everybody's help from technology, from AI, from the medical geology, from psychiatrists, from substance use professionals, of course from Ayurveda, from all medical fields, we are going to offer a helping hand by a timely prophylaxis and an intervention. So then you can see a ray of hope is still there. So it's not just a ray of hope, you can see. So thank you.